Tune in Saturdays at 1 p.m. for the Your Body is Your Pharmacy radio show. Hear from the doctors that were among the first in the U.S. to merge the ancient wisdom of Ayurveda and natural medicines with the advances of modern medical science. Listen to pioneer doctors Sodhi, Shailinder, and Anju Sodhi to keep up with some of the latest medical advances and learn from some of the true leaders of Ayurvedic medicines every Saturday from 1 to 2 p.m. with the Your Body is Your Pharmacy radio show on Desi 1250 AM, radio that listens to you. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022.
Good afternoon, folks. This is Dr. Shailinder Sodhi along with my co-host Dr. Anju Sodhi.
Good afternoon.
And today's the topic we have is one of the topics which actually affects millions of people around the world. And we are talking about the skin condition which affects a lot of the people, in all ages. And it's called vitiligo. And that's like white patches on the skin. So, Dr. Anju, this is fairly common condition which happens in young population as well as in the older population.
We see all ages, in the very early age too, and like in the teenage too, I have seen the patients. And also we like in the mid-age or the old age too. And sometimes I have noticed that people are too embarrassed to bring it to someone's attention. And which is not right, Dr. Shailinder, and like many times like the condition is like if it's in the beginning, I would believe it's much easier to control it or cure it rather than to hide it.
Right, and there's a lot of says about vitiligo that it's usually the person who has it, they live with a kind of stigma that it's a condition which really affects their appearance, and a lot of people who are very visual oriented and they always fear about how people think about them, what are the things people might say to them. So we are discussing this, and folks, today we are just going to be not going to be live on the radio. This is a recording which we are doing, and so that means we will not be taking phone calls on this show. So I and Anju are recording this show earlier, so you will hear the whole thing about the vitiligo. And the part of the way we are going to do is in the vitiligo, some statics and the percentage population which gets it and what you can do. And at our clinic, at Ayurvedic Naturopathic Medical Clinic, I've been practicing for last 25 years, and I have seen my share of patients, and I'm sure, Dr. Anju, you probably have seen your share of patients with the vitiligo as well. So the one of the things which the modern science tells us is about the vitiligo is that it affects both sexes, male and female, equally. It's not that it's only affects the male more than the female, and it also affects all age groups, though more commonly in younger population under 20 years old. So what really is happening in vitiligo is it is a condition which all of a sudden starts showing up on your skin. What happens is that you see the discoloration and the light patches on the skin. And that usually happens because the melanocytes, which are the cells which produce the pigment in the skin, it's called melanin, which gives the color to our skin, start dying. I mean, they start dying off. So these melanocytes, which are responsible to get our skin color, they do not produce that pigment called melanin, and all of a sudden we have depigmented skin.
Yeah, and the skin gets depigmented, and also then due to that, that melanin protects us from the UV rays too. Right. So due to not having that melanin, then the body is not protected from the UV rays too.
So what it means that we get burned easily, right?
Yeah, you can get burned easily too, and so like that. So
also increase the risk for the skin cancer.
Yeah, so it's need to pay attention if something like that. If you start seeing small patches, those are as Dr. Shailinder said, it's like the due to the melanin, which is doing the depigmentation, not enough. Skin is not producing enough melanin. If you start seeing, usually I have seen close to the hairline in my patients, they start seeing the small white patches.
Right. Though these white patches can happen anywhere in the body.
Anywhere in the body, that can close to the ear area or in the neck area.
Right.
So if you see something like the small, need to pay attention. Need to bring it to some physician's attention.
And the one other thing about this vitiligo, Dr. Anju, is it can affect the particular area of the body only, and it can be in the segmental areas, or it can affect the whole body.
Yes.
So that's the one thing about it. And like I said earlier, and usually it's a very traumatic event for the people who get it, and they don't know what to do and how to approach it. And and there are and majority of the time the question comes, what is causing this? Other than the why they start all of a sudden having depigmentation. So like I mentioned earlier, the vitiligo can affect people of any age and any race, or male or female, it does not matter. And currently there is not really big cure for it, though we have seen in our clinic where we were able to reverse certain cases. And with the fairly successful, I've been seeing this young boy, who is barely now 17, 18-year-old, but I started seeing him when he was 14-year-old, and I was able to take care of him with certain treatments and the modification which I did in his lifestyle. So we will cover that as well. Also, the vitiligo. Sometime, we really don't know what causing it, but there is a strong correlation with an autoimmune disorders.
Yes.
And autoimmune disorders, can lead to the skin depigmentation. And there are some indication in the past, some research article came out where they thought the viruses may be a trigger for causing vitiligo. And what my belief is, the viruses might be starting some sort of an autoimmune response in the body, which can happen in compromised individuals whose immune system is weak, and they may start reacting to have an autoimmune response later on after getting sick from the viruses, and that might lead to a vitiligo. The one of the things people also ask, if I have a vitiligo, would I be passing on to somebody else who touches me or sees me or I breathe on them? No, you will not. It does not spread. You cannot catch vitiligo from another person who has it.
It's not infection.
And it's not infectious and it's not contagious. So no reason to exclude those individuals who may be suffering from it. In fact, it doesn't do anything. It's one thing you can do is probably reach out to that person and make them feel more comfortable. And like I mentioned earlier, vitiligo is categorized into non-segmental and segmental vitiligo. So I will talk about that, Dr. Anju, a little bit more. And there have been, some treatments available with UVA and UVB light, which can help some individuals with the vitiligo. If sometimes the people, like I mentioned earlier, who have much open area of depigmentation, say like 30, 40, 50% of depigmentation, then the other therapies are done where the matching of the pigmentation is done by depigmenting the rest of the, which is hyperpigmented area in the body. So, these are all things which are available these days. And also we have lots of herbal treatments and lifestyle treatments.
So that is very important. When you start looking at you have start seeing some the symptoms, then you need to see somebody to pay who can address that. And if we there is also Dr. Shailinder, with the Ayurvedic point of view, there is some mental connection with the vitiligo too. So if people due to the lot of stress, they can it can aggravate it to the symptoms.
So that's very true, because stress actually compromises the immune system, and people who are prone to autoimmune, they can trigger the autoimmune response in the body.
Yeah, and there is also a study which showed excess dopamine in the patients with vitiligo. So dopamine plays many beneficial functions in the body, but the excess has been associated with depression. So it's reported that the treatment for vitiligo were not nearly as effective if the patients were depressed. So the dopamine has a effect.
So it's a neurotransmitter.
Yes.
So that there's a relation with dopamine, that means.
Yeah, and also with the Ayurvedic medicine, it's the liver. Liver is also you need to address the liver too. So liver is the organ in our body which helps to get rid of the toxins from our system, and it is also involved in the smooth functioning of the other almost every organ.
Right. So in Ayurveda, the liver is considered as an organ which actually produces the Ranjak Pitta, and the Ranjak Pitta is something which actually gives the color to the skin. So it's we really have to pay attention to the liver.
Yes.
When it comes to the pigmentation of the skin. So it's that important that we really target the organ and the skin in a way where we can actually address the liver and help. Like I was mentioning earlier, that the liver is an organ which really helps with the loss of the pigment tissues. So taking care of the liver is important, and liver can get affected with the lots of toxins in our daily things, and as well as the conditions which might affect.
It does play the major role into the digestion and in our immune system. So that need to be maybe the unhealthy liver can lead to the vitiligo too. And then the other thing is the circulatory system. If the circulation is not good into the body, it can, with the poor circulation and the cell health, including the melanocytes responsible for the skin color, can be compromised too. So that need to be pay attention on that too. So also with the dietary connection too, so a lot of vitamins and minerals, so we will be talking about that as well a little later. And with the Ayurvedic point of view, there is it's what you need to look for the earliest sign and the symptoms, Dr. Shailinder. So as we mentioned, the excessive or sometimes the absence of pigmentation, need to pay attention. Discoloration of the patches on the skin, need to pay attention. And like sometimes like the people come with a lot of itching and prickling kind of pain, like those type of symptoms need to pay attention. Like we call in the Ayurveda, these are the Purvakaram or Purvarupa, about that. So these are the early sign and symptoms. And then there is also the clinical sign and symptoms. So when, like Dr. Shailinder, when dosha chiefly vitiates the rakta or the blood, the patches will be red in color. So it would be red, looks red color.
So that's
of the patches.
creating an imbalance in the dhatu.
Into the dhatu.
Yeah,
yes.
dhatu which is the rakta dhatu we are talking about. So that leads to an imbalance of the pigmentation.
And that condition in Ayurveda is called dharuna.
Mm-hmm.
And then there is the another condition when the karuna, which is when the dosha is vitiated in the masa.
Mm-hmm. So that's the muscle tissue.
Muscle tissue, and then the color of the patches changes. It becomes like more copper color, and then it's the kilasa. So when dhatu vitiates the meda, which is the fat, then it changes the color. So then when that is the time when the patches will be white in color. So folks, if you start seeing some red patches on the skin and then it's turning into a little bit of the coppery color, need to pay attention. And then at the end, last, when it's vitiligo, it says white in color. So like it's like when you see something like the dark pigment, the depigmentation and the hyperpigmentation too, so that can change into the other condition too. So those were some Ayurvedic concepts.
And the modern concept, like I mentioned earlier, was the autoimmune disorders. And usually those can be like we have seen people with Hashimoto thyroiditis.
Yes.
And the thyroid diseases actually leads to vitiligo. So sometime it is that important that we need to look into the thyroid condition if there is a compromise. And whenever that is the case, we want to actually do the extensive testing to make sure there is no autoimmune response going on the thyroid, or the hypothyroidism is also lead to vitiligo too. And genetic oxidative stresses can also be reason. There are genetic component to the disease. So if there is any family member who had or ancestor who had vitiligo, and that component can play a role it may be a factor in causing a vitiligo in you. And lots of, like mentioned, stressful events, family events, divorce, or diseases, or somebody being sick in the family, or not a good work environment. All these stressful events may trigger an autoimmune response, which leads to an vitiligo. And I have seen people, Dr. Anju, those people who have critical sunburn, and those people who take sun bath for long hours and burn themselves, having depigmentation as well. So, and sometimes they trigger the concept which body start thinking of that it needs to start the process of killing the melanocytes. So in other ways, it is not a very healthy thing to do. And then sometimes people who might have cuts and injuries, which can lead to depigmented skin as well. So sometimes people who are exposed to some chemicals, especially those who are trying to lighten their skin and pigment,
yes,
those chemicals can really trigger the concept in a body which leads to hyperpigmented. So people who it's not common in this country, but a lot of dark skinned people like to lighten up their skin because they want lighter skin, and they go for chemical treatments which leads to this issue. And that needs to be, we need to be very careful, especially with that population who really want to lighten up their skin by using chemicals. And then there are nerve causes, neural causes, and then viral causes. I already mentioned the viral concept earlier, that it can be a reason in the individual sometime which can trigger the autoimmune response in the body. So there is about 1% of the population, Dr. Anju, 0.5 to 2% in certain statistics, but 1% of the population is affected by this in the worldwide. And there are the signs and symptoms vary really widely with the person to person, and it is more pronounced in the people who have a dark or tan skin, like Southeast Asian population, Middle Eastern population, African populations. But I have seen people even in the white Caucasians who have affected by the depigmentation or vitiligo. Some only acquire a handful of white dots which do not go any further, and then the other people who develop light, big white patches and can affect the larger area in the body. So, these are like I mentioned earlier, there could be non-segmental and segmental vitiligo. So usually the non-segmental vitiligo is the most common type of vitiligo, and it occurs up to 90% of the people who have this disorder. So folks, we are going to take a short break, and we will be back after the commercial break, and please join us and stay tuned.
Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information.
Thank you for joining us back, folks, again. And this is Dr. Shailinder Sodhi along with Dr. Anju Sodhi. And we are talking about vitiligo, and which is the discoloration of the skin pigment. And before the break, I was mentioning the majority of vitiligo is non-segmental. Majority population which has this discoloration or white patches on the skin, it's about 90% of the population will get that non-segmental type of vitiligo. In non-segmental vitiligo, patches often appear equally, on both sides of the body. And sometimes the measures, they have a little bit symmetry, other times they don't. The symmetrical patches most commonly appear on skin that is exposed daily to the sun, and such as the face, neck, and hands, but can also appear in other areas like back of the hands, arms, eyes. I have seen on the knees and elbows, feet, mouth, and even on eyelids and all that. These areas can be affected by this. So non-segmental vitiligo is further broken down into subcategories, which is like generalized vitiligo. That means no specific areas or size of patches. This is the most common type. That's what which we see the most commonly is generalized vitiligo. Then there is a acrofacial vitiligo. That happens mostly on fingers and toes, which people all of a sudden see the tips of the fingers, back of the nails, area affected by it. That's usually called acrofacial vitiligo. And then mucosal vitiligo is also the type of non-segmental vitiligo. This is a depigmentation, generally appears around the mucous membranes and lips. So usually inside the oral cavities or other cavities, you can see this depigmentation happen, and I have seen those cases as well. Universal vitiligo is the vitiligo which covers the whole body, the most of the body, and it's rare, but these are the people I have seen quite a bit, and they need to be very careful, the people who have universal vitiligo, because they are prone to have sunburn easily, and they can develop cancer, skin cancers. So need to be very careful with them. And these people really can have a lot of problem with the just having universal vitiligo. Then there is a focal vitiligo, which is one or few scattered white patches in a discrete area, most often occurs in young children. Usually doesn't bother, but people see it and they get scared with it. So that is one of the non-segmental vitiligo type. And then we have segmental vitiligo. The segmental vitiligo is the type which has spreads more rapidly and is considered more constant and stable than non-segmental. It is it's fairly less common and affects about I will say about 10% of the people who has the vitiligo. So it's again which affects only smaller population. Segmental vitiligo is more noticeable in early age groups, affecting about the children. The 30% of the children, those who are diagnosed, will have segmental vitiligo. It is usually non-symmetrical, tend to affect the areas of skin attached to the nerves arising in the like in the dorsal root of the spine. It is also more stable, less erratic, and responds well to topical treatment. So this is the type of the treatment with the segmental vitiligo, which actually behaves better with the treatment. So now Dr. Anju, as we are progressing, some of the symptoms which vitiligo can cause is it usually appear as flat white spots or patches on the skin. And generally the very first white spot that becomes noticeable is an area of the body that is exposed continuously to the sun.
Yes.
So that tells you the sunburn, which I mentioned earlier, can lead to this type of skin depigmentation. So it can start as a simple spot, a little paler than the rest of the skin, but gradually as time passes, this spot will become much paler until it becomes completely white. So the shape of these patches are completely irregular, and at times the edges can become a little inflamed with a slight red tone, sometimes resulting in itching, like you were mentioning earlier.
Yes, and that's again like with the, if we look at the Ayurvedic point of view, it's the different doshas, or the aggravation of the different doshas into the body.
Right, we mentioned like the Rakta Dhatu and the Meda Dhatu,
yes,
and Masa Dhatu.
And on top of that, like if there is like the aggravation of Pitta or Vata, can manifest like the different symptoms too.
Right, and very rarely it can cause itchiness, but majority time it does not cause any discomfort or irritation or soreness or dryness in the skin. The one of the thing about vitiligo I mentioned, it is a photosensitive. Patients should avoid exposing to the skin or direct sunlight for a long time because it just does not help. But they can enjoy the early morning sunshine, late evening, but not the very hot, sharp sun rays, because that will not be beneficial. In fact, early morning rays and late evening rays I do recommend to my patients when we are treating by applying certain oils which helps in bringing the pigment back. And we'll be discussing that as we go further in today's this show. So Dr. Anju, if you remember, in Ayurveda, we talk about pathya and apatya. That means the things we should combine and not combine the food.
Yeah, that is very important. Like in the Ayurveda, like with the vitiligo especially, or the some other like the skin condition, some sort of like when some food we should not be combining with the, like in Ayurveda it's like the people who eat fish or like the meats or even like the chicken too, especially with the fish or the shellfish, the milk should not be taken.
Right, and there is a controversy. The modern science do not agree with that concept. But in Ayurvedic text, it's mentioned is the particular type of fish, actually they call it chinchilla fish, which is the ocean fish, should not be combined with the cow dairy, because that creates the reaction or the autoimmune response in the body. So, even though the modern science says differently, but the Ayurvedic texts have mentioned very clearly that the chinchilla fish along with the cow milk, if taken at the same time when they eating it, it can lead to the vitiligo. And the reason for that is these have two types of different proteins. Milk has a different protein, and chilchira fish has a very different protein, which sometimes causes the reaction, and they do not match energetically, and leading to this problem. So, even though the modern science may not agree with the meat and dairy, but the people, I will say, those who have autoimmune disorders or those who have genetic predisposition to vitiligo, they should not be doing this kind of...
They should not be. Definitely people with the autoimmune or the thyroid issue too, so they should be avoiding it. Some other, reasons in the Ayurveda is also like the suppression of the natural gases.
The urges and all that, so they say, if you, not to suppress any urges. So it's you have to, if you need to use the restroom, you go and use it. Don't.
And some people has habit of the stopping themselves to going
right, and that could be also one factor.
Yeah, and also there is with the Ayurvedic point of view, the performance of physical exercises in the excessive heat, and sometimes after taking heavy meals, when we at our office we tell our patients all the time that no heavy exercise after meals, but sometimes
right, and that's I see that people usually we say when you have taken a meal, take a gentle walk 10-15 minutes, to help to just get the food going down. But some people eat heavy and then they go out and work out excessive, which is actually again
imbalancing the doshas.
Right, it will lead to dumping of the food, which actually create absorption of large molecule of the food in the small intestine, and which leads to again response, which can be autoimmune type of response.
And also, Dr. Shailinder, use of some people start drinking cold water after the excessive sun exposure, and that is also against.
So right, in this case, cold water mean by ice cold water, really chilled water, which really again creates that imbalance in the pitta in the body.
Yes. So all these factors these are the very small factors, and we tell our patients all the time, with the Ayurveda, it's a Vata, Pitta and Kapha, which is air, fire and water imbalance, and that can lead to anything. So these are the small steps, but if you have these type of issues, need to pay attention on these small things too.
Right. So the other thing is when we talk about the diet and in our clinic, we do very extensive examination. And
so how there is that you want to talk about little bit more about the treatments for vitiligo?
Right. We definitely want to do the treatments. I will probably cover some of the what are the modern treatments available, and what can people do in home. So so the modern treatment which are available is most commonly talked about is the UVA and UVB light, or the phototherapy, which help people to regain the pigmentation. And there have been studies and there have been clinics where people been exposed to where they expose the affected skin. In this case would be the light pigmented area, the leukoderma area or vitiligo area, to the UVB lamp light, and it's the most common and very simple treatment, and it can be performed easily either at home or in office with a small lamp. You can buy these UVB light bulb and you just use your table lamp or something and expose to the vitiligo area, and that will be very helpful. Home treatment is recommended because it is the most effective when the patient uses the lamp daily. And so if you need to have a daily exposure. If these treatments are carried out in clinics, the patient needs to visit 2-3 times per week. So if you don't want to do at home, you're going to end up going to the clinics for at least 2-3 weeks, which slows down the reoccurrence of the vitiligo. If the white spots are located across large areas of the body, Sometimes UVB phototherapy will have to be performed in a bigger settings like in hospital or where they have full body treatment available and your whole body is exposed to the UVB light, ultraviolet B lights. It is important to mention that even if evidence has suggested that ultraviolet B phototherapy and particular when combined with other treatments has positive effect on vitiligo, it is still quite unpredictable and undependable. That means they will come back, these spots will come back, even you might think that it may not come. So there is really not much treatment, because again we need to look at the whole picture, not along just the patch up
So
treatment.
that's what we like. There is a drawback in the modern treatment. Like they try to do as we have take some Tylenol or ibuprofen for the headache. So those treatments, that's why it fails. But I really think like if we combine it, if we look into much more like what are with the Ayurveda, like what are the which doshas are more imbalanced into that particular person, and start working on that. Like if there is somebody is having some pitta disorder, and then they need to be pitta pacifying diet. We need to start with the gut first, and that's how we treat our patients at the office.
Right, and you know the like we are talking about Ayurvedic treatment. One of the other phototherapy Dr. Anju is called, it's called UVA light therapy.
Yes.
And I talked about earlier UVB light. Now there is another called UVA light. It's ultraviolet A light, which is most commonly conducted in a hospital or clinic setup. So in this type of treatment, people are those who are suffering with vitiligo. There is usually a drug given to them, which makes their skin more photosensitive to the ultraviolet light. So once you take that drug, then you are exposed to the high doses of UVA light. It does cause noticeable improvement, and patient will normally have several sessions, and usually you may have to go from 6 to 12 months for the treatment. So it's like a whole time, you need to go quite often. And usually, couple times a week you have to do these treatments. Even though these UV and UVB light are given to bring back the pigmentation, but there are lots of side effects from these UVA, UVB light. There are certain, again, chances of developing skin cancer.
Skin cancer, photosensitivity more, and chances of coming back. Like there is a lot of side effects too, along with it too.
Right, and particularly, I'm not very big keen of this, but sometimes the tough to treat these cases. You may have to do UVA and UVB treatments to get it. And then there is very much which is not a treatment, but it is called camouflage.
Yeah, that is like a covering. That's like a lot of time if it's on your facial area, like the body part, you can be covered, and the facial it can be camouflaged with the cosmetic colored creams and makeup. And that is available too.
All right, and the patient can select the tones which matches their skin features, right? These camouflage actually can work nicely with the individual who do not want to go with UVA, UVB treatment, and they have skin which can be matched evenly, and that can work. And these type of treatments, the camouflage can work very well where you are only using light makeup to match up. But again, this is not the treatment, but it is a cosmetic treatment. And then if you remember, if I mentioned about the depigmentation.
Depigmentation, yes.
So the depigmentation is a treatment again, which I do not support whole lot, and I don't, but this is available.
Yeah.
And in this case, Dr. Anju, what we do is...
It is toxic. It can be toxic for the liver.
And these are the chemicals which we are using to match up the skin tone. So in this case, suppose somebody has a vitiligo and majority of their body. So what we do is, rest of the body which has a pigmentation, we need to depigment it. So in this case, we use special lotions, like hydroquinones or mequinols or monobenzone. All these type of drugs are used, to, it's like lotion applying on the body. So this treatment is actually permanent and can make the skin more fragile. So that means that your skin gets very sensitive because we have used these chemicals, and long exposure to the sun can lead to a sunburn and again more prone to skin cancer. When we're doing the depigmentation treatment, it takes about 12 to 14 months depending on the factors and the amount of the depth of the skin we want to depigment. So it's not really my suggestion to the people who suffer with this condition to go for depigmenting, but in desperation it can be done, but again it comes with lots of consequences. And then there is a topical corticosteroid treatment.
Yeah, that is much more common in the, like, they start using the steroids on the on the affected area. That which can, like, in the small, like in the beginning, it can be helpful. Again, it's a steroid and it gets absorbed into the skin too.
And it does make your skin thin.
Makes your skin thin. So again, it has the side effects.
And but
then there is also, like, you talked about the PUVA therapy too, so ultraviolet, Sorelin plus ultraviolet.
Yeah, and there are other drugs like Sorelin which can be used along with the UVA, UVB, and again that works really well. But again, they all have some sort of a certain side effects which makes skin more sensitive.
And there is also a vitamin D, like the topical ointment too, which can be used in conjunction with the corticosteroids or the light treatments.
That leads to
some
rashes,
side effects.
And you can have itching with this treatment, but it works. It's called vitamin D cream. In the form of calcipotriene, and we do this kind of treatments which are available to the patients. And then, very in extreme cases, tattooing and skin grafts. Tattooings are available where the skin, and tattooing can actually do the good skin matching forever because they can be permanent tattoo. But again, it's quite involved. And it works best around the lips and people with a darker skin. And drawback only includes is difficulty matching the color of the skin to 100%. But sometimes the tattoos can fade, but that's rarely. But they do not tan. So sometimes skin damage caused by tattooing might spark the generation of another patch of vitiligo. That means we tattooed one area to match it, but if autoimmune response is going on, that would be still happen. And the skin grafts, that's an extreme cases. In some time, taking the normal skin color is put it in the area where it is. Again, it leaves some scarring, but again, does not cure the treatment. So really, as for the modern approaches which we mentioned about, it really does not offer a whole lot other than the palliative treatment.
Yes, and plus it can be toxic. It
Right.
can have its own side effects later on. So, but there is some things available. So, like as we said in the beginning, that there is not whole lot like the possibility for the vitiligo cure. So, but as I mentioned, we have the Ayurvedic clinic, and we do see the patients and we do treat this too, and we work through the diet. So we work through the vitamins and the some of the herbal stuff too, and we work through the detoxification. With the
and Dr. Anju, the one thing I always tell is when you look at the gut, because there is a strong relationship with the gut.
So whenever we have this type of patients, this is come under the autoimmune. So we work through the gut. So first of all, Ayurvedic point of view, we have to address the gut. So first of all, we need to find out what dosha imbalance person has, and we have to start giving the food accordingly to make the gut stronger, so they can whatever the treatment they are doing, it can help them.
And also, the one of the other thing which we talk about is the liver, the taking care of the liver health.
As we talked earlier.
Right. So, the thing, people who drink alcohol or other doing the drugs, that can compromise the liver and leads to this type of an issue. So people who have a vitiligo, alcohol is not something you want to do. And that really will, like I mentioned earlier, creates an imbalance in the Ranjak Pitta, which is the coloring or the melanin of the that leads to imbalance in it. So definitely you want to avoid any sort of toxic exposure to your body, either it's an alcohol or drugs. And the other things which we talk about is try to
like
de-stress
as we
yourself.
mentioned, stress can be a factor too. So need to do the things so you are not physical or emotional stress.
Right. And then we have herbal treatments like babchi, which is a very much Ayurvedic herb, and these are the Sorelia seeds which can be taken internally, and it actually helps the pigment to tan when you expose to a little bit of the sun, early morning sun and evening, and that you can do it on the regular basis. But again, before you start this,
we have success with we have used these seeds and we have given out to our patient for the topical use and as well taking too.
Right.
So, and it has helped.
And other thing which I will mention is that before you do this treatment, make sure you get yourself checked, because there may be underlying factor, autoimmune disease or thyroid, which can be corrected, and your vitiligo will heal on its own as soon the thyroid is taken care, or Addison's disease or adrenal glands taken care. So all those things can be managed on a treatment wise and with the Ayurvedic and naturopathic treatments. And then there is also other things which you can do is radish
seeds,
and that really works. And a majority population knows about the basil leaves, and they can have basil leaf topical application or take internally. That helps too.
That helps. Basil leaves because it has the antiviral and anti-aging, so which are beneficial for the skin. And basil leaf paste mixed with the lime juice is also promotes the melanin production. So that is also an effective home remedy for vitiligo. And then there is also the turmeric, which turmeric mixed with the mustard oil is also a beneficial natural cure for the vitiligo too. And also we do give turmeric to take by internally too as a capsule, or you can use the fresh turmeric,
right, and cook the food
more with the fresh turmeric or the powdered ones. So, but use the organic one, because that's other thing is very important, because this is the autoimmune. Used organic stuff as much as you can, so you are not getting exposed to the other pesticides.
And one of the thing, Dr. Anju, I have recommended my patient to drink water from the copper pots, and these copper utensils are very effective in promoting the production of melanin by the melanocytes. So what we are trying to do is we are trying to bring the life back to the melanocyte, so they start bringing the the pigment into the skin. So it's very easy treatment. Again, you pour water in the copper pots and let it sit on all night, and drink it in the morning, and that really very helpful in bringing the tone. And also copper is good for getting the blood pressure and other things under control as well. So it's a good thing to drink.
Yes.
And it's very much highly recommended in Ayurvedic treatments. We mentioned already, babchi seed, which can be applied even topically as well by grinding and making a paste. And that really also but it can burn sometime in some individuals. So be careful when you apply it topically, because you can have a sensitive skin. And
also, Dr. Shailinder, then khadiravati, a lot of people know about the khadira, which is
that's the Katachu plant.
Yes, and that is also as a decoction is very great for the treatment for the leukoderma or the vitiligo. Also, there is the neem, which is also great.
Neem is actually very good as for when it comes to drinking every day. And neem is actually considered a skin tonic. I mean, the neem is a beautiful herb, and it basically very bitter.
And it's a blood purifier. It has it's considered as a herbal antibiotic kind of thing too. And
And I find the neem has many uses. And in this
a lot
case,
of people know about the neem too. So drinking a glass of neem juice daily. It's bitter though, but you can take the capsules too.
Pomegranate juice, pomegranate leaves. These are really helpful. Very much drinking every day. Again, the besan or the kala chana we call, or the garbanzo, black garbanzo. Applying as it topically to the skin helps to regenerate the skin.
Also, the figs helps, like the making a paste with the figs by adding water into it also helps with because it helps with the circulation. It purifies the blood, and so that can be used too as a home remedy too in a paste form.
And ginger leaves or the ginger root, you can make a paste and apply it to the skin area, actually, which increases the circulation to that particular area and can bring some pigment back. It's very simple remedy. You can do it, and that's very helpful.
So, we want to say, by stimulating melanocytes to restore the production of melanin to bring back normal color to the skin would be the looks. Whatever, all these home remedies we mentioned, that will help to bring the melanin to the normal.
And then the last and final we want to approach is to the nutritional deficiencies, which are important.
Very important.
And we want to make sure all the B vitamins are rich in the food, and especially B12 that is considered as, and the folic acid. These are very important, which helps with repigmentation, and there have been research done on it. So make sure you do eat fermented food. If you are not a vegetarian, you can eat liver. And also sunflower seeds are very helpful for the vegetarian population. B12 is usually we find in the cheese and lots of meat product actually, and you can do it those people who, and also in egg yolk, whole egg, that also brings a lots of B vitamins. Liver in the animal also. Then
How about vitamin D? Vitamin D also plays a major role.
Right,
So
vitamin D, and we are the population who is deficient with vitamin D, especially in the northwest.
and so make sure that your vitamin D is checked and you are not deficient in vitamin D.
And like I mentioned earlier, drink water from the copper pots, which really helps to bring it back. So folks, like we mentioned, there are certain foods you should avoid, don't drink alcohol, don't have too much of caffeinated drinks, and avoid highly seasoned dishes and sugar. Try to keep them low. Again, these are the certain things which I would like you to consider.
Yeah, if you have the, as I mentioned in the beginning, if the spots are small and you need to go to somebody, and so it can be addressed. When it's small, it's easy to cure it by looking at the different the diseases, underlying diseases. And if the small spot, it can be covered or camouflaged too, so no need to be you have something.
But this is also the time when you actually go to your holistic or naturopathic doctor and see what might have caused, and if this can be stopped further, so before it becomes a major. So as we are coming to the end of the show, folks, I would definitely say please make sure eat right and avoid all the allergenic foods, and as soon you notice something is going wrong with your skin, come and see us.
Yeah, it would be much more easier for you, if somebody's address it as early as possible.
Right. So we thank you for listening to us today's show, and I hope you learned a lot. And in order to make an appointment with me or Dr. Anju, you can call us at 425-453-8022. And again, the clinic number is 425-453-8022, and that's Ayurvedic Naturopathic Medical Clinic in Bellevue. And we appreciate your listening to us and tuning us. Please give us your feedback. We will be happy to hear it. So, so have a good afternoon.
Thank you.
Thank you.